All right, so we're here today with Julie Brummett and Molly, our pretend patient, and we are discussing Perio Protect. So Julie, how many times a day do you promote Perio Protect?
Multiple times a day, almost everybody. Even if it's just a review of prior discussion about Perio Protect, there will be that discussion.
Okay. And what's a typical Perio Protect patient
There truly isn't a typical Perio Protect patient because there are a lot of different advantages to Perio Protect. So it could be, of course, for that patient who is delaying periodontal treatment. It can be for the patient who has gingivitis and they haven't got to the point where they need scaling, but they're headed that way. They have the bleeding fours, they have the inflammation, they're just not doing well. Also patients who have that difficult topography to navigate around. If you look at the x-rays and you go, wow, this is going to be a difficult spot for this patient to get access to kill this off. This is a potential problem area. There are also patients who have sensitivity. I like to recommend Perio Protect with MI paste for my patients with sensitivity. Also, anybody who's interested in whitening their teeth, you might as well invest the money in whitening your teeth and getting your gums healthy at the same time.
So how do you decide who you will focus on? How do you make that decision? Is it with chart prepping or where does it start?
A lot of times it does begin with chart prepping, going over the x-rays, what are the past periodontal measurements, what was the bleeding, the amount of bleeding that they had, what were those discussions that we had in the past, what has been leading up to this.
Okay. Do you look at the health history?
Yes.
And what about patient concerns?
Yes.
Okay.
So if a patient comes in and they say, you know what, I had a stroke this summer, I had a heart attack, my doctor's concerned about my blood pressure. These are all good ways to introduce Perio Protect because you know that there is a link between having that healthy periodontal tissue, having the healthy gum tissue, and having the healthy blood pressure or being at a lower risk because you're not sending those toxins. You don't have that chronic infection that's changing things, making those blood vessels more narrow, making the arteries more narrow, and affecting them that way in terms of their systemic health.
Okay. And tell me about your probing technique. How do you do that? Are you prepping the patient ahead of time as to what to listen for?
Yes. I mean, they know it's like, okay, if you hear a lot of 1s, 2s, and 3s, that's good. If you start hearing 4s and 5s, that means we've got some issues. Bleeding is always cause for concern. Anytime I say bleeding, that's a concern.
So when you're probing, you're actually probing out loud?
Yes.
Okay. And you're also noting the bleeding on probing out loud?
Yes.
Okay. So your patient is aware of how their exam is going before you're even completed. Okay. So we have in the chair today, we have Molly. And tell us about Molly's health history.
Okay, so when Molly came in today, we gave her health history, and she has indicated a couple different concerns. First of all, when she was at her doctor, she was diagnosed as pre-diabetic. Mm-hmm. So she doesn't have full-blown diabetes, but she's on the verge. The other thing that she indicated was a history of hypertension. So those are two things that could be helped by having the Perio Protect Trays, reducing the amount of inflammation in her mouth and in basically the toxins that are going through her bloodstream. So not only would that help you get healthier in terms of your gum tissue, but your systemic health as well, because there's such a close link between those two issues.
And when you probed, you found 4 millimeters?
So we had 4 millimeters with bleeding all on the back. Bleeding 4, bleeding 4, bleeding 4.
Okay, so her treatment today would be, her prophylaxis today would be coded as what?
The 4-3-4-6. She is not what we call routine cleaning. She is not a perio patient, but she's in between. So there again, we've got the bleeding, we've got the inflammation. We need to do more than a regular cleaning. Mm-hmm. You're not quite at that point where you need deep scaling, but if we don't get a handle on this, we're going to be looking at that in the future. So we're going to try to do this, and we're going to try to get a handle on this, so we don't have to go to perio route.
And Julie, when you're explaining this to Molly, what chairside tools would you use?
Okay, so I want to show you, I have a couple really great things. The first thing I want to show you is this tray, because I want you to see, first of all, this is a very comfortable tray. It's very low tech. When you put the gel in, the tray is special because it's got like a margin here that will hold the gel deep within the gums. The gel is minty, it's fresh, it tastes good. One of the things that I like best about this is you can clean all your teeth at the same time. So when you get up in the morning, you want to get in the shower, you can put this in, get ready, take care of all your teeth at once, and your first treatment is done. Then in the evening, if you're exercising, if you're relaxing, if you're doing some work on your computer, whatever you're watching your Netflix, okay? You put this in and you're taking care of your gums. It isn't like, oh wow, I can't do anything for 15 minutes because I've got this in my mouth. No, you can do whatever you need to do with these trays in there, okay? I also want to show you, I've got, this is the pamphlet that shows all of the systemic issues that are associated with having the inflammation in the mouth like you have. So there's a risk of type 2 diabetes, cardiovascular disease, respiratory disease, blood clots, stroke, Alzheimer's disease, and chronic inflammatory conditions. So when you're wearing trays like this, not only are you having a nice healthy mouth, but you're kind of slamming the door on all these other things too. So I'm sure you're concerned about some of those things that your doctor mentioned about, you know, let's make sure that you don't become full-fledged diabetic. Let's make sure that we get your blood pressure under control. So this is a nice, easy way to incorporate good health into your everyday life. So there's that. And I just want to show you, these are some before and after pictures. And if you look at these pictures, they're really amazing. There's a lot of redness and inflammation there. You can see how puffy that is. This is after a couple months after the use of the trays, and this is 6 months after. This is a really good picture. These are bloody gums. They're very inflamed. And you can see, look how nice and healthy and pink they look. There's not the bleeding. There's not the inflammation. The tissue looks nice and tight and firm. So, and I like it because you can do it in the privacy of your home.
Can you turn that to show? That's a case study.
Yeah, so
Perio
these are
Protect
really
Therapy
good pictures
case
that
studies.
show different areas that were captured before treatment, during treatment, and then 6 months after treatment.
Great, thank you.
So I like this very much.
So what do you think, Molly? What do you think about this treatment?
I think I have to think about it.
Of course. I'm going to give you some information to take home, but would it be okay if I just call you in a week or two just to kind of touch base with you and see if I can answer any questions for you that you may have?
Absolutely.
Okay, great.
Good.
We'll do that.
Very good, thank you.